Hello everyone and welcome to a new episode. My name is Rupen. I'm an internal medicine resident in Ottawa, Canada. And today I want to talk about one of the most important topics in residency and is how to study in residency. Many junior residents, many medical students ask me how to study during residency, how to prepare for an elective, how to prepare for rotation. And I ask myself a lot, what is the best way to study during residency? And what I learned over the last 3 years is, to be honest with you, there is no single best way. There is a way that fits you, and you have to have the insight on what fits you and what works for you. But that being said, actually there are some important factors you have to take into consideration when you think about what resources you are going to use during residency. And the four factors are: 1, it's time; 2, what to read about; 3, resources; 4 is the medical knowledge. Okay, so let's talk about time. Let's take a typical resident. They usually start around like 7 in the morning and they finish at 5. If they were lucky, they will be at home at 6. They have dinner at 6:30. So from 6:30 p.m. until 10 p.m., that leaves us around 3 hours and a half. Most people go to bed around 10 or 11 or they watch TV or whatever. So we have 3 hours and a half per day. And in those 3 hours and a half, you have to answer hundreds of emails that you have in your inbox as a resident. Lots of emails will come to you. The second thing is, you have maybe to do research, or maybe you have to go out, you have to enjoy, talk to family, friends, and you have to study. So as you can see, the time is very limited, and it's much less when compared to medical school, and it's much less also like the energy that you will have during this time. It's less because like you're going to be really tired during the day. Residency is great, but also it's demanding physically and mentally. So we have limited time. That brings us to the next factor: resources. So if you have a limited time and you go and choose huge resources like Harrison, good luck. I think it's going to take you so long to read about a single topic in Harrison, and it's not the knowledge that you're looking for. Why? Because in residency you're going to use, you're going to learn about diagnostic reasoning, which is different from what you learned in medical school. I'm going to talk about it. So what to read and what to use, it's completely different when it comes to medical school. And I think the best advice is you have to stick to a schedule. Either you create a schedule, and let's say this week you're going to do like pulmonology, next week you're going to do cardiology, and the week after you're going to gastroenterology, or let's say you're doing an internal medicine rotation and you're going to read about the patient that you saw during the day. And 90% of the patients are bread and butter cases like pneumonia, CHF. But let's say today you read about pneumonia. Please have a checklist. Please have an organized way to make sure that you are that you are meeting the requirements about every topic. Like pulmonology, at least read about COPD, asthma, at least read about like pneumonia. If you're reading about like cardiology, at least read about congestive heart failure management, pericarditis, and ACS. So have a checklist and make sure that you take off those diseases that you read about. So at the end of the day, when you read about the bread and butter cases, and let's see during your internal medicine rotation you did not see syncope, for an example, read about syncope. So having an organized way to approach your reading is very important. Either create a schedule or read about the bread and butter cases, but make sure, please, that you have a checklist that you go through every topic and you read about the most common cases or the most common presentations. And the third thing is resources. So as we said, time is limited, and using a huge resources, it's going to be really hard and painful. So the best resource is the short and the sweet resource. It's the resource that is electronic and available, or it's a resource that is small and it can fit in your pocket, which I'm going to talk about. And finally, the medical knowledge. The medical knowledge in residency is different from what you acquire during medical school. In medical school, you learn about heart failure, epidemiology, pathophysiology, medications, prognosis, and then you read about pneumonia, epidemiology, pathophysiology, medications, treatment, prognosis, how to follow up. But in real life, you're never going to see heart failure by itself, or rarely you're going to see heart failure by itself, and rarely you're going to see pneumonia by itself. In real life, one patient will come with many conditions, especially if you're doing internal medicine. Most patients are complex, even outside of internal medicine. Like even surgical patients are usually complex. They have like pneumonia, COPD/asthma. They might have heart failure. They might have acute coronary syndrome. They might have on top of that AFib. They might have on top of that diabetes. They might have on top of that a CKD. So patients are complex. And what you need to learn in residency is diagnostic reasoning, which is completely different from what you learned about diseases in medical school. Because in medical school, you learn about diseases. In residency, you learn how to manage those diseases. And there is a very interesting article about it. It's called Educational Strategies to Promote Clinical Diagnostic Reasoning. It is in New England Journal of Medicine. Please check it. So now let's talk about the categories. So I usually, like over the last 2.5 years, 3 years of residency, I divided the learning resources into categories. And let's talk about category A. So when it comes to category A, it's one of my favorite because it's short and sweet. And in category A, we have Lantier, the Red Book, the Blue Book, and the Approach to Internal Medicine. Those are the best resources, in my opinion, to study during residency because they are short and they are sweet and they are to the point. They give you the practical knowledge that you want to use when you're approaching patients, especially when you're on call overnight. Lantier, it's a Canadian-based app that you can buy it for $24 Canadian per year, based on last time I checked. It also gives you 7 days of free trial. Lantier is based on Canadian guidelines, but I still believe that you can use it even if you were in the US. You can download the app on your phone, you can buy the book, or you can access it through the web. And it's one of the best resources in my opinion because it's short and sweet and you can access information quickly because you can search informations, and also it gives you very important and practical knowledge, especially when you're on call. Like if I'm on call and I'm tired and let's say I want to look up cellulitis management, I'm not sure which antibiotics to prescribe, I just go to Lantier. If I'm not sure how to approach a COPD or a heart failure, I just go to Lantier. If I'm admitting a patient with a toxidrome or opioid intoxication and just want to make sure I'm not missing anything in the management of this patient, again, I just go to Lantier because it's available for me. Like if I'm using Epic on the computer, I just open Chrome and log into Lantier through their website and I search whatever topic I want to learn about or I want to read about overnight, just to make sure that I'm not missing anything. And the nice thing about it, it's short, so it can give you the important details that or the important orders that you don't have to, you have to make sure you put in or you don't miss. So I think Lantier is one of the best resources and it's highly recommended. And just a disclaimer, Lantier is not supporting this episode. I just like the app, okay? So, and then we have the Red Book and the Blue Book. The Red Book is the internal resident survival guide. It's written by resident staff in McMaster University, Canada, in Hamilton. And the Blue Book, it's the Pocket Internal Medicine. I think it's very well known in the US. So the resident survival guide is the same as the pocket medicine, but the pocket medicine is more common in the US and resident survival guide is more common in Canada. They are both good because they can fit into your pocket and they cover many important topics and they are to the point. The only thing is you have to buy them as a hard copy. I think you can still buy the pocket medicine as an electronic copy, but most people I saw around me they usually buy the hard copy, and over years it might get old, so if you're adding any comments they might get lost here and there if you're gonna buy a new version or new book of it. Also, they are really important or really good, especially if you're on call, because they are short and to the point. And again, they talk about medical reasoning and they give you the important information that you need when you are approaching different topics. And next we have the Approach to Internal Medicine. Approach to Internal Medicine, it's a book that is written by authors in Calgary and also in Houston, Texas, MD Anderson. It's a great resource, short and sweet. and to the point. It covers many important topics in internal medicine, and it's highly recommended by many residents, whether it's in Canada, I think also in the US, because again, in 2 pages it covers whatever you need to know about the disease to survive during the day and during the night when you are on call. So Lantier, the Resident Survival Guide, the Pocket Medicine, and Approach to Internal Medicine, I think those are one of the most important resources. Choose one, pick one, and stick to it, and using during your residency. You're going to learn a lot from it because those resources talk about medical reasoning and diagnostic reasoning, and they give you the important information you need about bread and butter cases. Moving on, we have podcast and YouTube. So this is category 2, okay, or let's say category B. Podcasts, I believe they are also very important to use them when you are in residency. I love podcasts, and my advice is turn your car into a university. Literally, I listen to podcasts when I drive, when I'm going home, or when I'm coming back from where I'm driving to work, or when I'm coming back from work. And the nice thing about podcasts is they give you a very most of them, they give you like a practical knowledge, and you also get to know the person who's in the podcast. Let's say like the curbsiders, when they host someone, they talk about that person, their background, their publications, and they also talk about things about outside their medical career, about life, what books they like. And I really like to listen to the first segment of the podcast because it's interesting to know what things people like to do when they are in medicine. I truly believe that even if you are in medicine, you still have to do things outside of medicine, and you still have to maintain your hobbies, even in residency. So podcasts are great because you gain knowledge, and also you get to know people who are famous in the field that you're interested in. The problem I found in residency in the beginning is podcasts could be like arbitrary. Like if one episode is talking about heart failure, the second episode could be talking about chronic kidney disease, the third episode could be talking about something else. So if you are studying in a systematic way, let's say this week you're doing cardiology, and today you're gonna read about heart failure, and you want to listen about a podcast talking about heart failure. So what I do is I search on Google heart failure podcast, and then I look if any of the podcasts that I like has an episode about heart failure, and I add that podcast to my note, and I listen, or like I add it to my favorite collection in the app that I use for podcasts, and I listen to it. I find that way also helpful if I want to like learn systematically, but I still want to listen to podcasts and help me to go through organized way in my studying plan. So podcasts are great, and my favorite podcasts are the Curbsiders, the Intern at Work, the Internet Book of Critical Care, Annals of Medicine, and there are many podcasts there. I think if you search online, if you search Google, you're going to find many podcasts. Choose one and don't stick to it. Go and listen to other podcasts. Podcasts are great. And then in category B, also we have YouTube. YouTube, it's a university by itself. Amazing, like how much information you can find, and they are explained in very simple way. My favorite YouTube channel is Louisville Lectures. They are great, they are awesome, because they talk again about important topics for the American board, and they talk about important bread and butter cases, and they also talk about like practical knowledge, medical diagnostic reasoning. They teach you how to approach patients, which is very unique, and thank you Louisville University for putting those episodes online. I really like them, and I really encourage you to look them up. And then next we have category C. So category C is question banks. When it comes to question banks, I love question banks. Why? There is a lot of evidence that if you solve a problem without having the knowledge, this problem will help you to solidify the knowledge. By that I mean, if you do questions, even if you don't know anything about the topic, and then if let's say you did the question, you solved the question and you did not pick the right choice, so you will learn about it because you're going to solidify your learning by taking the wrong decision in the MCQ. And I think the three important question banks out there are the New England Journal of Medicine, Knowledge Plus, and then we have the UWard, American Board of Internal Medicine, and MKSAP. So those are really great question banks. Each question bank has its pros and cons. My favorite is UWord. I really love UWord. I admire UWord. Again, just a disclaimer, this episode is not by UWord or any other company. I'm not like, but I just like love UWord for some reason or other. So the nice thing about UWord is like it covers many important topics that you're going to see on daily basis. Also, it covers many bread and butter and rare cases. I used UWord when I was a senior on the ward. So every day before we start the day at 7 o'clock, before we write the list, I made sure to do like 10-minute teaching, and I pick a question from UWord and I just teach the juniors, and everyone liked it. I literally like stand up in the room, write the question on the board and ask everyone, and even the staff would participate. So everyone liked the idea of starting the day with a question, and I used UWord. You can use the Medical Knowledge Self-Assessment Program. I really like their questions, and the New England Journal of Medicine. Each question bank has its own pros and cons, which I will talk about it in future episodes. And then moving on, we have category D. So category D is resources that you can use to look up information, but I don't really recommend to use them as learning tool. Like you can read them, but don't try to memorize them. And we have Medscape, UpToDate, and Dynamed. Those are great resources. It depends also sometimes like universities or residency program will provide you with access to UpToDate or Dynamed or other resources. They are great to look up information. Let's say you are seeing a patient with rare condition and you just want to refresh your idea, refresh your thoughts about that topic. Or let's say you are doing neurology and there is a common condition like Guillain-Barré and you haven't seen Guillain-Barré for a while and you just want to learn about the management, or you want to read about the management overnight about Guillain-Barré syndrome. So I think UpToDate is great, or Dynamed or Medscape, whichever you like. But again, those are huge resources that will give you lots of information, and I don't advise to use them for learning and memorizing, but they are great if you want to read them. And finally, we have the last category, category E, I believe, textbooks. I don't advise to use textbooks during residency because they consume lots of time. Like my favorite textbooks is Current, and also some people like Harrison. They are great, they are awesome if you want to look up information, if you're just going to read, but don't use them to memorize and don't use them to prepare for a rotation, because there is lots of information there and you can get lost and you can spend lots of time and you can lose time. You want to learn about the bread and butter cases when you're preparing for rotation, the most common things that you're going to see during that rotation, and you need to master the diagnosis and the treatment of that condition. If you go and read about very rare things that you're not going to see on the ward, let's say if you're doing like malignant hematology and you learn about like very rare malignant hematology cases and you don't read about febrile neutropenia, I think you're wasting your time. If you're going malignant hematology rotation, 100% you should read first about febrile neutropenia before going and reading about nice rare stuff. Okay, and now we come to an end. If you like this episode, please hit the like button and subscribe to my channel. You can follow me on Instagram, on YouTube, and Facebook. And please, if you have any topics that you want me to talk about, if you want me to address in the future, please leave it in the comments. Thank you. Have a great day.